Good afternoon and welcome to Digital Health Canada's session on driving the future of digital health. I'm your host, Peter Jones, the healthcare industry lead for Microsoft Canada. Today, we're going to talk about how innovation is driving new ways to deliver patient care. We're going to cover a number of topics, one being how Jewish General Hospital is leveraging mixed reality to address COVID-19 challenges. But before we begin, first and foremost, I want to start off by saying thank you. Thank you to all of our healthcare providers and first responders across the country who have put themselves in the front lines to protect the health, safety, and prosperity of all Canadians. Our Microsoft healthcare team has been privileged to have played a small role leveraging our technology platform to partner with healthcare organizations across the country to respond to this COVID pandemic. Microsoft recently released the Microsoft Cloud for Healthcare, which helps address all those key needs and accelerate healthcare transformation. At Microsoft, we're focused on trust and we're always empowering, never competing with our healthcare customers. And most important, we're not monetizing your data or patient data. We scale through industry-leading cloud infrastructures and really a strong partner ecosystem with over $15 billion invested in cloud infrastructure and 68,000 partners delivering solutions into the market. We talk about security and compliance. We have the highest levels of commitment for security and meeting industry compliance standards and certifications. We spend over $1 billion annually on security and cyber defense operations center to bring together security response experts from across the country and across the world to help protect, detect, and respond 7/24 to security threats in real time. You look at what really we're offering around the Microsoft Cloud for Healthcare is really enhancing patient engagement, empowering care teams to collaborate more effectively, and really get access to data to improve both clinical and operational outcomes in a secure, compliant way. So if you really look at deeper insights about what this is really about a better experience for the patient, delivering more personalized care, better patient insights, and really delivering state-of-the-art telehealth solutions across the country. We actually focus on clinical analytics and operational analytics, but really one of the biggest struggles is really getting that data to interoperate and flow across the continuum. And Microsoft has really built out a robust offering in these ways. If you look at better care and how do you provide collaboration tools for clinicians and care teams to provide better care, we've actually built out a whole framework around Microsoft Teams to enable that care coordination and collaboration, and even doing things like continuous monitoring of patients in their home as care moves outside the walls of the hospital. And really what Microsoft is offering with the cloud for healthcare is really an infrastructure that provides application infrastructure, data and AI, modern workplace, and business application tools to really give you that service and capability and really building you a blueprint or a framework to deliver solutions in healthcare. We built out common data model. We built out health connectors, the ability for interoperability using FHIR and HL7. We built analytics tools with our Power Platform and Power BI tools. And really, all that really is brought together through different AI capability and machine learning tools as well. So really, we're building that foundation to then deliver those scenarios or those solutions like patient outreach or COVID-19 assessments. How do you get care teams to collaborate using tools to share documentation across the continuum? There's a number of scenarios that we've created that really builds that solution that you just really need to configure to adopt it into your organization. And we've really done this with a number of partners. If you can see at the top of the chart here, you actually see all the major organizations that have really embraced the Microsoft Cloud and are building solutions on it. So what I want to do is now segue to some examples of how Hololens is being used in healthcare today. One example here is CAE Healthcare. They're really using this mixed reality capability to then allow surgeons to be trained and using virtual cadavers to really start to build a better experience for how they could see and render the human body in 3D ways. It's really quite remarkable, and there's a few videos online that you can actually search and see where CAE is using this to train surgeons to become better surgeons. Another example is Medivis. They're really, again, empowering surgeons to be able to look at 3D imagery of the human body or the brain and actually help assist them in surgical procedures. So there's some really innovative ways that HoloLens is being used to actually advance healthcare in amazing ways. So really today we're here to talk about what Jewish General and Dr. Rudski has done around leveraging Hololens to provide better patient care in and around COVID-19. With us today is Dr. Rudski. Dr. Rudski is the director of the Heart Center at Jewish General and professor at McGill University, specializing in all aspects of non-invasive cardiology. Montreal's Jewish General Hospital is ranked #1 hospital in Quebec and the lead hospital in a network of over 30 healthcare institutions. They were designated by the Quebec government at the outset of the pandemic as the province's lead hospital for COVID-19 care. Welcome, Dr. Rudski.
Thank you very much. It's really a great honor to be here and a pleasure. I look forward to participating in Digital Health Canada's Driving the Future of Digital Healthcare. This is really a key topic to me personally and to my healthcare network, the Jewish General Hospital, which is part of something called the CIUS Centre-Ouest de Montréal. So it's a network of multiple different institutions where we have our lead flagship hospital, Jewish General. We have a network of rehab hospitals, chronic care facilities, first-line clinics, etc., transcending into home care. At the Jewish, we understand we have a patient-centered mission, and we understand in order to achieve this patient-centered mission, we actually need to innovate and need to transform in this digital revolution. We have an aggressive program for this. We launched an incubator called Orot just recently. And we have a whole digital program from novel wearables to connected healthcare record, leveraging the fact that we do transcend across the entire lifespan. And the Hololens is one of our key projects that we're working on through this incubator and through our innovation project. So it's really a great pleasure to be here. Thank you.
Okay. So what I wanted to do is get you to share with our audience a little bit about what the challenge was with COVID-19 you were dealing with at Jewish General.
Yeah, so we're sitting 7, 8 months out. It's really incredible how your perspective changes. There's this when we look back at the first wave, there's so much we would have done differently. There's this old quote that when you're looking forward into a crisis situation, everything you do is overreaction, but when you're actually in it, everything that you're doing seems to be inadequate, and it's always difficult to predict what you're going to need. So our hospital was actually planned to be a pandemic hospital when the ministry approved our plans. In fact, our top floor was called the pandemic floor. It's an entire floor of negative pressure rooms. And in fact, the majority of our intensive care beds also were designed to handle pandemics at being negative pressure. So it was kind of natural when we saw this coming, the ministry designated us to be the lead hospital. So for 3-4 weeks, pretty much all the hospitals were sending their cases to us, including the largest hospitals within the city were transferring their cases to us. So we had a lot of preparation to do and a lot of challenges. What we discovered was really it's not just the negative pressure rooms; it's the whole model of healthcare, and the model of healthcare delivery starts with people. So when you go from 1 intensive care unit to 3 intensive care units and no COVID wards to 5 COVID wards, you have to obviously do things very differently. At one point we had, including a rehab COVID floor, we had over 200 COVID patients in our hospital. So we discovered that the commodity wasn't the rooms, it wasn't the equipment. Of course, we went through the same panic of all the other hospitals saying, what if we run out of ventilators? We took stock of our ventilators, made sure we had adequate. We figured out how to go from 30, 40 ventilators to up to 80 ventilators if needed, and we made sure that we have adequate supplies. But really, it was nursing. It was nursing and physicians. We have a certain number of critical care nurses, and then we had to switch over to say we need a whole lot more. So we changed how we did it. We did some team training where you'd partner an experienced critical care nurse with other acute care nurses, but not necessarily critical care, and they form these teams to work together. Similarly, for critical care doctors, we recruited the anesthesiologists and some of our other advanced specialists, and they work in teams. And we'd form these teams of a lead physician and a secondary physician and a resident on the COVID floors. So it was a huge challenge, but also a huge opportunity to figure out how can we do things differently. And in fact, when we look at our numbers, we've done extremely well in terms of the outcomes for the patients.
Okay, well, thank you for sharing that. So help me understand, or really, how did you address this issue with Hololens, right, to protect your staff and patients?
So, it's kind of funny. I had seen the HoloLens very, very peripherally, cursorily in the past. And we had an industrial engineering company called Auger Group, who was based in Trois-Rivières, led by Marcel Lafontaine. And so Marcel's son, who leads their medical division, which was a nascent division, who knew our hospital in that context through cardiac surgery, reached out to us and said, we have these HoloLenses, industry shut down. How can we help you help your patients and help your staff? So we kind of went from 0 to 100 in a couple of weeks, having never used it, to coming up with interesting use cases and applications. Whenever you have an opportunity like this, obviously you have to imagine it, but you have to think, you don't want to have the technology necessarily drive your needs. You want to have your needs drive the technology. So we thought, what are our needs? And looking at the personnel issue, not only do we want to provide excellent patient care, we want to provide dignified patient care, and a lot of the issues were end-of-life issues for these elderly COVID patients. The first wave saw devastation through a whole bunch of the nursing homes. So a lot of very elderly patients were being transferred, and they were not going to survive, and it was a tragedy. But you want to make sure that end-of-life care, which is a very important mandate, is going to be well applied. So for our healthcare network, we had one ultra specialized nurse in end-of-life care. That person is on call 24/7. Can't be everywhere, can't be at multiple different institutions. So we said, how can we improve that? So the HoloLens was the opportunity for that. So we designed the use case around that. So you have an inexperienced palliative care nurse and a nurse not experienced in palliative care assessing and treating this end-of-life patient. So we looked at the HoloLens using a combination of live assist and to a lesser extent guides, but guides in order to there are some forms, electronic forms to fill in. The nurse was able, we pre-programmed the HoloLens to have videos to share via the second person, via Teams, to show how to insert the special type of intravenous. It's not really intravenous, it goes subcutaneously just in order to infuse pain medication. We walked through the bedside nurse in terms of how to assess the needs of the patient and provide the care. Similarly, there's still patients, not necessarily COVID patients, but COVID stretched the resources everywhere. We have the same issue with wound care. Wound care is also a specialized nursing task. There's an assessment component and a treatment component, also with multiple different products, critical in order to make sure that the wound is treated appropriately. A deep sternal wound in the chest, for example, in the States can cost $250,000 to treat one episode. So you obviously want to make sure that it's treated properly. So we did the same thing. We went through a remote guidance of an assessment by a specialized wound care nurse, including assessing the depth of the wound, the extent of the wound, and then providing treatment recommendations. And the wound care nurse can guide and observe the bedside nurse doing the procedure. Again, electronic forms, documentation are all done through the HoloLens. And the final use case that we did, and I'm just going to go in afterwards, how we're doing another one now, which is very, very promising. The final use case that we designed was troubleshooting an agitated patient on a ventilator, COVID patient on a ventilator. It's 2 a.m, patient's thrashing. The RT, the respiratory technologist, may or may not be available, but in any case, even if they are available, there's still some components that require guidance by the physician. So through the HoloLens, they call the physician, the intensivist. So the intensivist can be covering more than one unit then, and providing the expert care. Again, electronic forms, uploading labs, uploading blood gases, uploading x-rays into the field of vision, and then doing the assessment, guiding using live assist, drawing which button to turn. Once you determine what the treatment is, prescribing sedation, also through the tablet, and showing all the capabilities of what can be done, including two-way communication through the HoloLens to the patient to try and establish that connection rapport. So those are the use cases that we modeled. And we've actually applied the wound care one in a patient. And what we're doing now in our latest phase is we're doing an agile development process, chronic care institution. So we had our first session actually 2 days ago. We're going to be doing our homework, coming back every week or two to refine the process. So in this case, it's more physician-centered, just because there are a limited number of physicians to train with the HoloLens. So what we're going to be doing is we're going to be doing buddy rounding. So you have a COVID ward of 25 patients or 30 patients. Historically, traditionally, that physician would go in, would have to read the chart, would have to examine each patient, would have to write the orders, would have to order labs, order medications, and then very, very important in the care of COVID patients is communicating with the families, giving them updates. So then after doing these rounds on these 25 or 30 patients, would then have to call 25 or 30 families to say that your family member is doing well, or these are the issues. So you can imagine if you only have a limited number of patients, as a limited number of physicians, including numerous physicians who are either elderly or have chronic medical illnesses that you can't put them into a COVID hot zone, they could support this as the backup physician on the other side of the tablet. They could upload the labs. They could order the medications. They could also split the family calls if they choose to do them afterwards, because they will have rounded on the patient. So each physician, each provider only has to half the number of calls. And even better, which we tried, was making a call directly from the HoloLens to the family member. So here you say, this is your family member. You can see how he's doing. So very, very powerful technology. So that's where we're going, and that's going to be our first wide scale implementation, hopefully within the next few weeks.
Yeah, that's wonderful. That's amazing what you're doing. So help me understand that. So you're really wearing a HoloLens and connecting via secure live video feed using Microsoft Teams. Like the attending clinician is virtually linked to specialized experts, or in some of those examples, family members, that allows people to interact and see a lot of the information right in their field of vision. That's wonderful.
Yeah. And so it's very exciting. And remember, all this is being done hands-free. So you can actually be examining the patient, co-examining the patient. You can be delivering treatment at the same time. And one of the big things is, they have voice recognition. You can dictate your notes. If the other person at the other end isn't going to write the notes, you can dictate your own notes, and then again, upload it securely into a connected healthcare record, or an EMR. There's a whole bunch of steps, obviously, which we can go through a little bit later in terms of making sure that this can work in an optimal manner, but the opportunities are just huge.
Yeah, that's quite remarkable. Yeah, well, so those are some great examples of what you're doing now. So do you feel this will get you better prepared for the second wave that we know that's coming?
Well, the second wave, we know a little bit more of where we're going because we've already been through it, but we also know the challenges that we have. And our challenges really relates to much less so the PPE issue. PPE issue seems to be with ramping up production, seems to be mostly solved, but it's trying to minimize the exposure time of healthcare workers. The method of transmission keeps on changing. Now we believe that it is airborne. The risk is if you stay in an enclosed area for more than 15 minutes. And in certain care areas, we have, our hospital is a very modern hospital where we have the COVID patients. And we have, in one of our towers was designed, as I said, with state-of-the-art technology. But when you get overwhelmed, and in the chronic care facilities, they don't necessarily have the same ventilation. There were outbreaks amongst healthcare workers, principally outside of the hospitals in some of these older, less well ventilated settings. So you want to try and minimize the amount of time in the exposure zone. A safe exposure is considered to be less than 15 minutes in an enclosed space, but even then you'd never know. The other thing is, so despite our knowing so much more, we have staff that are tired. Really, it's not just physically tired, they're mentally tired. And that's what we're seeing. So we have to motivate them by saying, this is what we can do in order to make your lives and your ability to care for your patients easier. So for the CHSLD example with the HoloLens, we're very, very excited about this. Because it's also going to make everything more efficient for the nurses. They'll be going to be able to deliver the care in much more rapid and efficient ways. We're also looking at wearables to minimize the contact of nurses with patients, not necessarily directly related to the HoloLens. We've kind of went from in the first wave, having a telephone to speak to the patient, or we actually ordered through Amazon at one point, I think 50 to see whether we can have some kind of video connection. The microphone wasn't adequate, and the speaker wasn't adequate, so that didn't work out. But we went through so many different iterations trying to improve things. But now, by knowing more, we feel better available. But one of the other frustrations is knowing that a lot of this is potentially preventable. So healthcare workers, and I hope everybody attending this meeting will recognize and promote the message that that social distancing will prevent us from having to have our healthcare systems overloaded.
Yeah.
You know, we always talk about in medicine prevention. Hospitals are great at dealing with acute care problems. We'd rather not have to deal with them by prevention.
Yeah, no, and I've seen a number of examples of hospitals giving the patient a tablet and the physician a tablet outside the room and connecting using Microsoft Teams and having a video consultation real time, both with each tablets. And there's lots of hospitals putting that in place as well, just to kind of have that dialogue with the patient.
So, you know, one of my other jobs in my hospital in the healthcare network is I'm also a CMIO. And so I'm involved in the digital health transformation. We have a chief digital officer, we have an innovation officer, we have a CIO, and we work collaboratively. And you know, we had been talking about telemedicine for several years. How do we promote telemedicine? And one of the problems was security and legal aspects, which hadn't caught up, and also you know, the dirty little secret remuneration. So doctors don't get paid. There was no format for physicians to get paid to do telemedicine visits. Well, all those problems disappeared. They melted away over a few weeks. So now we use a number of different digital platforms that the ministry has funded. Our legal governing body for the physicians has given us approval to use it, but obviously in a secure manner with appropriate documentation and patient consent. We're also moving towards digital stethoscopes and a whole bunch of other electronic tools. As a cardiologist, it's more difficult to do a virtual visit other than to follow a patient who you know well. A new consultation does require you to assess the patient. And you're talking about the virtual consultations with a smartphone inside the room or a tablet inside the room. That's quite effective, but you're not hands-free. The Hololens gives the ability to do hands-free, to have 10 people on the call at the same time. You can even have a case conference through the Hololens to discuss in real time what to do about a patient while the healthcare provider in the room is evaluating the patient.
Yeah, no, that's amazing what you're doing. So is there any advice that you could give or guidance you could share with those watching on what your experience has been?
Yeah, so this is a big thing because it's very, very difficult to stand up a whole new way of doing things. And there are technical components, there are regulatory components, and there are also clinical components. And those three components, they all start with the word planning. Planning and anticipation. Without that, you're being reactive instead of proactive. So regulatory, when you're working with sensitive healthcare data, you have to make sure that you're connecting to a secure network, and that has to be a ministry approved network. Any external partners have to be approved by the ministry, and that takes time. With the HoloLens comes with a license, for example. The license can't be provided by our industrial engineering partner because they're not say a licensed healthcare ministry provider. So the license has to reside with the ministry. So you really need to get that regulatory component. You have to get a legal consultation with your hospital lawyer to decide whether you need consent or not. So all these things have to be worked out before you can implement. From a technical perspective, obviously HoloLens is a 4K device, a lot of data flowing through. You got to have a network that can support it. So one of the first things you have to do is you have to work with your IT department right from the beginning. And not only can they tell you about the capabilities, but they can help you make sure that it gets implemented in a manner that's effective. At the nursing home, we were about to launch it with 4G because a lot of chronic care facilities don't have wireless, but they just put it in. So when we did our first trial on Tuesday, actually the wireless was operational. So we were quite lucky. We didn't have to set up a hotspot and burn through data. So the next part is partnering with an experienced technical partner. So we had the privilege of working with Auger Group. Auger has extensive experience with HoloLens. They're a Microsoft developer as well, and they've applied their technology to large industry. So very complex processes, 150 to 250 steps to maintain heavy equipment, using guides. So in fact, their first demo, I said, show us how to do something using guides. And so they said, did something where they, overnight, they created a demo from a video that we had on YouTube of how to don and doff PPE, the protective equipment, using guides, and they showed us the value of that. And it was only an 8 or 10 step process, but it shows the potential. So you don't need them for content development, but you really need them for their technical expertise because they've done this. So buying a HoloLens on Amazon, which I don't think you can do because it is a regulated product, and saying, oh, I'm going to start doing this, doesn't work. And if it does, you're going to be banging your head against the wall until you get it right. Next lesson really gets to the clinical side. Clinical side, as I said, you have to think about your use cases. Where is it going to be advantageous? And then what we did is we assembled a team. Our team consisted of a number of physicians and nurses. So I was co-leading this as DMIO and as the director of the Heart Center. We have a chief nursing information officer also who was on this team. I had a cardiac surgeon, a cardiac intensivist, anesthesiologist intensivist thinking about the ICU scenarios. We had a wound care nurse, and we had an internist who had experience and training in healthcare outcomes. So that was our core team in order to get this going. When we thought about our use cases, we said, go home, write down every single step in great detail so that we could walk it through, and so that our engineering partners, when they program the HoloLens, would know exactly what they need to program. So that we did that, and then we did, before they programmed it, we did a tabletop simulation. We ran through it, just acting out the roles, and then we did the same thing again with the HoloLens on, tabletop simulation before we went to any bedside. So a lot of planning. As I mentioned, for our CHSLD, for our chronic care facilities, we're using an agile development technique, which I think is really key. You have to do all those steps before, and then you have to pilot it in stages. And at each stage, you work through in the facility. Then you say, what do I need to be done? So our last one is, which electronic forms do we need? How are we going to get the note into the chart? What are we going to do at bedside versus remotely? And then we send the engineers back with their homework. We have our homework in order to optimize our forms and our electronic prescriptions. And we meet again, we do it again in 1 or 2 weeks. We do this iteratively until we get it right, and then we're ready to go. One of the challenges also when you're dealing with industry is industry has a different way of dealing with things than healthcare providers. Industry, decade ago, everybody was holding up the lean method, and everybody was going for lean training. Lean training is how do you get the product onto the shelves as efficiently as possible. You look at the Apple development, it's the golden thread. It doesn't have to be perfect. You just got to get it out there. For healthcare, sometimes we can accelerate things, but other times we really can't cut corners. So you have to make sure your partners understand that healthcare works at a different pace than industry, because the objectives are a little bit different. The other thing in healthcare is you're dealing with healthcare professionals who are already working full time, but you need them as content experts and as people who are going to be executing. So you have to work around that. So you have to have a realistic timeline with your expectations. You can't say, oh, I know that I can get this done in a week or 2 weeks, because whenever you think that, it's not really going to happen. So realistic expectations, planning. Work out the technical details, get your IT department involved early, regulatory early, and then it's all about planning, team building, planning, and then executing at a pace that you know is going to be safe and effective.
Yeah, no, that's wonderful insights, and thank you for sharing that. So anyways, that's remarkable, the stories you've shared, kind of the experience, and how that's really helping you address a lot of those challenges within the hospital. So that's amazing. So again, I'd like to thank you, Dr. Rudski, for sharing those insights and really that future vision of what mixed reality in healthcare can become, right? That's amazing. Thank you.
My pleasure. Thank you very much.
So with that said, those of you who would like to learn more about mixed reality and the Microsoft Healthcare Cloud, please visit aka.microsoft/healthcare in Canada. There you can find healthcare technology webinars like this, Canadian healthcare use cases, and some of the great partner innovations that are available in Canada to help support patients and provide better patient care. Those of you that are interested in learning more about AI and professional development, we've created a free AI business school for healthcare professionals in partnership with INSEAD, right? There's a number of modules for on-demand that cover a lot of real AI healthcare use cases and really helps you improve and focus on AI if you're looking at leveraging that for your institution. We partnered with Digital Health Canada here today to provide that continuing education around AI through something called AI Business School. So please visit Digital Health Canada's website for more information. So again, thank you for attending today's session, and we hope you enjoy the rest of the conference. And again, thank you, Dr. Rudski.
Thank you very much.